Hello everyone, I hope you are having a wonderful day. Thank you for joining me. I'm Samantha with Samantha's Respiratory World, and today we're going over A and P of the upper airway. I'm breaking this down into sections, so this is going to be part A as you've seen, and the rest of the sections will follow. So before we get started, I just want to go over a couple of vocabulary words that I want to brush up on from A and P 1 and 2. And those words are anterior and posterior. Remember, anterior is front, posterior is behind, and I want us to know superior and inferior. Superior is above, inferior is below. So that way when we're talking about where things are located within the body, we have that as a point of reference. Alright, so let's jump in and get started. Alright, so the first thing we need to look at is the primary functions of your upper airway. The first thing is it is to act as a conductor of air, and the second is humidifies and it warms or cools the inspired air that we take in, and it prevents foreign objects from entering into the tracheobronchial tree, and it participates in speech and smell. Okay, in this next slide, you're going to see the nasal cavity, which is the first part that we're going to be discussing. I just want you to get a picture of what everything looks like in the inside of the nose and get familiar with the terminology associated with the areas. Alright, now we're going to have to look at the nose, and the primary function of the nose is to filter, humidify, and condition the inspired air that we breathe in. And it also houses the sense of smell. Next, we're going to look at the inside of the nose and see what cell structures make up the nasal cavity. So the top picture shows 1/3 of the nasal cavity being non-ciliated stratified squamous epithelial cells. And the second picture below, it shows the ciliated pseudostratified columnar epithelial cells, and it lines 2/3 of the posterior nasal cavity. Now we need to look at how air moves through our nostrils down into our respiratory tract further. So first thing we need to understand is when it enters in through our nostrils, there is little tiny hairs that you can kind of see and feel at times, and those act as a filter, and it is the first line defense for our lower airways or the tracheobronchial tree. As the air passes through all of the hair follicles and goes into the next part of the nasal cavity, it's going to go into the superior, middle, and inferior nasal turbinate, and it separates the inspired air into different air streams, and this plays an important role in humidification, warming, and cooling inspired air. And it does this by the mucosa in the nasal cavity. It contains a rich supply of blood vessels and nerve endings, and when the inspired air is brought into the body, the vascular system becomes engorged with blood, and it helps warm the air up as it travels into the oropharynx down into the lower respiratory tract. While it travels through the nasal turbinates, it also has the olfactory region, which is the receptors for the sense of smell, and it's located near the superior and middle turbinates. As you can see in the picture, you see the olfactory bulb with the receptors hanging down in the nasal cavity. So like we have previously discussed, there's a lot of nerve endings that are in the nasal cavity, and they do several different functions. One of these is a natural reflex mechanism that they can trigger, and it is known as the sneeze reflex. And this happens when there's an irritant such as dust or a pollen particle that encounters one of these nerve endings in the mucosa, and it just triggers an automatic sneeze to try to get the foreign object out, or the irritant out of the body before it travels further down into the respiratory tract. So now we're going to get a look at what you can see on the clinical side when it comes to the nasal cavity. And the first thing we're going to see, or it could encounter, is a nosebleed. And this occurs when humidity is low. It's common to see in children 2 to 10 years of age and adults 50 to 80 years of age. There's two different types of nosebleeds. There's an anterior bleed, which is most common. About 90% are anterior bleeds, and this is stopped when the nose is pinched or packed with cotton. The next type of bleed is a posterior bleed. These are less common and usually occur at the artery located in the posterior part of the nasal cavity, and it occurs most often in your elderly population. It's very serious due to the more complications that can come out of this, and usually the patient has to be hospitalized for treatment. Another clinical experience that you could encounter dealing with the nasal cavity is a nasal congestion, and this can influence taste buds since 80% of your taste depends on your sense of smell. And this happens because of the olfactory receptors are being blocked by the congestion in the nasal cavity. This is commonly seen in patients with head colds. The next thing you could possibly see in a clinical setting is rhinitis and sinusitis. And this is from inflammation of the mucosa membranes in the nasal cavity. It can produce excessive mucus, and it also causes nasal congestion as well as postnasal dripping. And it's caused by the cold viruses, and it's also caused by streptococcal bacteria and various other allergens. And when the infection is in both the paranasal sinuses and the nasal cavity, it is known as sinusitis at that time. Anything else occurring with the nose would be like a traumatic event. Alright, the next part we're going to discuss is the oral cavity. And this is just a general picture of all the different structures that we're going to be discussing in the next coming slides. So give you a few seconds to look it over, and you can pause it and look at it, take notes. The cell structure that is found in the oral cavity is your non-ciliated stratified squamous epithelium, as you can see in the pictures. The first part of the oral cavity that we're going to discuss is the tongue. This is located in the floor of the oral cavity, and it fills majority of the oral cavity. It is also composed of interlacing bundles of skeletal muscles and fibers. The intrinsic muscles of the tongue is not attached to bone, and this allows the tongue to change its shape. It is also used for speech and helps mix food and the saliva together, and then pushes the food to the back of the pharynx to be swallowed. Next, the extrinsic muscles of the tongue. These extend from their point of origin on the bone of the skull or on the soft palate, and allows movement such as protruding the tongue outwards and retracting it inwards, or moving it from side to side. Underneath the tongue is the Lingulafrenulum. I'm not sure if I said that right, but it secures the tongue to the floor of the mouth, and it limits posterior movement as well. And that's all the structures of the tongue that we're going to discuss right now. Now we're moving on to the roof of the mouth. There is a hard palate and a soft palate. The hard palate is composed of the palatine process of the maxilla and the palatine bones, and the soft palate consists of a flexible mass of densely packed collagen fibers, and it projects backwards, downwards, ending into the softy, fleshy structure known as the uvula. And The levator veli palatinum muscles elevates the soft palate, while the palatopharyngeal muscles draws the soft palate forward and downward, thus closing off the opening between the nasal and the oral pharynx, especially during swallowing, sucking, blowing, and certain sounds of speech. The last part that we're going to talk about in the oral cavity is the posterior section of it. This is made up of the palatoglossal arch and the palatopharyngeal arch. Collectively, both of these arches are known as the palatine arches. And we also have the palatine tonsils. These are located between the arches on each side. And then we have the pharyngeal tonsils and also the nasopharynx adenoids. And all three of these lymphoid tissues are believed to serve as immunological defense mechanisms for bacteria, which we observe this especially with the tonsils, with strep throat or tonsillitis, as they have bacteria that has collected on them. And normally it is treated with antibiotics, of course. So that is wrapping up the oral cavity and the nasal cavity. If you have any questions or anything like that, please let me know below. Don't forget to subscribe, like, and comment on my video. And thank you guys for watching. I hope you have a wonderful day, guys. Thank you.